Mr. President, I'm here today with my colleague, Senator Capito, to really talk about something that is getting a lot of discussion but needs even more attention from this Congress and has been getting attention, but it's the opioid epidemic, the epidemic that the President has rightly called a crisis and then turned to the Congress and said, find the money to solve the problem. And we've been doing a substantial amount of that. But I think we see a clear desire here and in all of our states to find a better solution. This is an issue that's hit every town in America, small and large, I believe. According to the Center for Disease Control and Prevention, over 40,000 people died from opioid overdose. Now, this is just a fraction of the people that had an opioid overdose. These are the people that died from an opioid overdose in 2016. 40,000 people, over 90 Americans every single day. It was a 28% increase over 2015 and a dramatic increase over where we were just 10 years before. Opioid overdoses now surpass car accidents as the #1 accidental cause of death in the country. In both of our states and our surrounding states, I think almost every one of them have had more overdose deaths in 2016 and increasing a number, I think, in 2017 than car accident deaths. The Center for Disease Control estimates that the economic burden of this epidemic is almost $80 billion a year. You know, we've just gone through a tax discussion, an economic growth discussion, when we've been talking about billions of dollars. Seldom were we talking about $80 billion to do something with or to stop doing something with. But the economic cost of all of this, lost productivity, addiction, the crime related to that addiction, CDC says $78.5 billion a year is now the cost. The members of our committee, we're both appropriators, the members of the appropriating committee have looked at this carefully. Our colleagues have had a chance to confront this issue in our committee head on. We've brought bills to the floor that have passed, that have made a big difference in a short period of time. Over the past 2 years, not counting what we hope to do this year, the committee's increased opioid funding by over $900 million, nearly a 200% increase for the Department of Health and Human Services, more money for justice, more money for the Department of Veterans Affairs. This funding is worked to focus on things like developing alternatives for pain management, giving our state, federal, and local law enforcement partners the tools they need to combat opioid trafficking, ensuring that first responders, that we're working to see that there are better ways to respond with opioid reversal. One of the things we've seen recently, Mr. President, is that the opioid is now, opioids of all kinds are now laced with new drugs like fentanyl that you don't even know what you're taking. And the Narcan, the former way to deal with this, and still the most effective way to deal with this, you think you've dealt with the problem, and the dose is so strong that same person in just a few minutes lapses back into another seizure attack that has often been fatal, even though people were there and the traditional way to respond was there. It wasn't enough for what's going on now. One thing you'd have to tell anybody doing this is it is unlikely that you have any real idea what you're putting into your system. What you think was a narcotic high the day before could easily kill you the next day. We've been looking for better ways to monitor programs so that prescriptions in West Virginia and Missouri are both states that where in some counties, in some areas, the numbers are just ridiculous of prescriptions that people have been walking in to the pharmacist with. The Committee on the Department of Health and Human Services that funds that department, that would be the committee that we're both on. In the last 2 years, we've increased funding by 1,300%. Now, $745 million, 13 times more than we were spending just 2 years ago. We've given grants to states in ways that they haven't before to look at specific state needs and ideas they have to deal with this and then share. We've looked at increasing federal surveillance of how prescriptions are being written, how drugstores are becoming the conduit, how many things are coming through the mail, to find new ways to determine whether this just is a reasonable thing in the area that these drugs are going into. We've looked at ways to increase the tools necessary to communities and first responders, talking right now to the National Institute of Health about what they can do on a number of fronts. One is to work with the pharmaceutical companies themselves to develop alternatives to the kind of pain management we've had. And also, let me say on that front, we've gone through a period where actually doctors and hospitals were too often graded on whether people had any pain or not, as opposed to whether they had pain that they didn't understand, pain that was unacceptable. More and more people ought to be saying, okay, as opposed to taking this potentially addictive drug, give me a dose that's not as addictive, and maybe I'm still more achy than I would be otherwise, more pain than I'd have otherwise, but I understand it and I'm aware of it, and I'm not out there in some cloud of no pain, but not much of anything else in terms of real quality of life. So looking how we can work with these companies for pain management, I think it's time, and I've talked to them, I think the pharmaceutical companies, it's time for them to step up. Maybe in partnership with NIH, to where there's some federal money out there to encourage more private sector money to find alternatives that are less addictive and better understood, to find more effective and affordable ways to respond. Just the amount of money in the first responders kits around the country and local governments paying for the Narcan, the more expensive injectable treatment. We need to look for ways where that can be more available in a way that local governments have a better way to deal with this. This needs to be dealt with locally. The first responder is going to be a local person. If you're a first responder in a fire department, if you're a fire department that also has first responders, your department is 3 times more likely, your fire department, 3 times more likely to go to an overdose than they are to go to a fire. That's where we are in this situation today. And trying to figure out at home, as we all are trying to do, what the impact really is. I had a meeting not too long ago with medical professionals, with state officials, with emergency responders in Springfield, Missouri, to talk about how we deal with prevention and treatment and recovery. We talked about the critical partnership between local, state, and federal law enforcement and the dangers that the first responders themselves face. Sometimes what people are putting into their system is so powerful and so addictive that walking into the room or touching the clothing becomes a potentially great danger for the person who's there to help you. Talk to doctors and hospitals about the challenges they face in prescribing less habit-forming pain medications, and how patients still are not fully aware of the danger of dealing with pain if you overdo it as you're dealing with pain. Talking to one person there who talked about his daughter who had just gone to the dentist and got pain medicine with no sense that that pain medicine could be addictive, that you should stop taking it when it's done its job rather than when the last pill is gone. And then, of course, the other new issue of under-prescribing. Nobody likes to go back to the pharmacy twice to get the same thing that they just got a few days ago, but giving people more of these pills than they need to take themselves are set in the medicine cabinet, Mr. President, doesn't make any sense. Our state has large urban areas, but it also has a lot of small and remote communities, and frankly, rural communities have been hit particularly hard by this crisis. Certainly, West Virginia is a state that understands this. There's been no more vigorous advocate for funding and new ways to solve this problem than Senator Capito, and I'm glad to be here with her today as we talk about this. But I can assure the people we work for that this is a top priority. It's been a top priority for over 3 years now. The first 2 years showed dramatic increases in the willingness that we have to deal with this and the breadth of how we deal with it. That's one reason, Mr. President, we need to move on and get this funding bill that should have been done by October 1 done right now. And as we get a new number to deal with, one of our priorities will clearly be the opioid epidemic, and one of the leaders in that discussion will clearly be the senator from West Virginia, Senator Capito.